Terrific. Call our meeting to order. Okay, doesn't seem to be a lot of bills. That's a good thing.
No.
Passed them around. But we do have some minutes. If everybody would like to look them over. Hi, how are you?
I'm great. How are you?
Hi.
Nice to see you.
Nice to see you.
Move to accept the minutes of July 21 as presented.
Second.
The second, Joe?
Yes, second, sorry.
Any other questions, comments? All in favor?
Aye.
Aye. Okay. Welcome, Kathy.
Well, thank you for having me. I have the floor.
Can you join us? You sure do.
So pleased to join you. I have some information for all of you. Oh, yeah. Thank you so much. You're so welcome. Thank you. You're welcome. I have all the sheet too, if you're coming. And then I can do mine when I leave it back to you. So thank you for having me. So I don't know how much Joyce has told you, but we had met about this drug that's around. It's called Kratom. Is anyone familiar with it? So I was not familiar with it. I had a call from a constituent about it. So it's being sold at like smoke shops at Cumberland Farms, like that type of stuff. And it's highly addictive. So the constituent that called me, it was about her friend's son who was buying it with cash at a premise, some place in Kingston. I think it was the smoke shop. I'm not sure if it was, we talked about the mobile, what it was. Actually, not sure exactly what place it was. But he was buying it and he became addicted to it. Didn't know he was addicted to it.
Good evening.
And was at this same establishment, and someone behind him said, how long have you been on that? And he said, a few months. And he said, you need to go home and ask somebody for help because this will ruin your life. And he did. He wound up in rehab. So since then, I reached out to the chief. That's where we go to, but the chief. So I reached out to the chief and, doing some research, there's been some towns that have banned it in the Commonwealth, and some states that have banned it too. But more and more that I hear about it and that I look into it, it's highly addictive. It's an opioid and it's highly addictive. And we're just selling it here in Cumberland Farms and in smoke shops. And there was another story. There's some bills that are at the State House that you'll see in your packet. And one is from a young man who never did any drugs, never smoked. Well, obviously he didn't smoke, he didn't, drink, didn't do anything. And he thought that this was like a health thing. And he wound up dying. Yeah, he wound up ODing and dying. So there's a bill for him. And it's interesting. I was just at a conference and there was someone there, big sign, great, trying to tell me it was okay. It's okay. It's natural. It's what they put in it, right? It's what they put in it. It makes it really, and
So
it wasn't,
Sorry.
exactly, right?
So it's not exactly opium though. It's
No, I said
an
so is
opioid.
opium.
Okay, but kratom is an opioid.
Yes.
Substance.
Yeah.
Correct, okay.
But it's technically not an opioid.
Correct.
It's technically not.
Technically not. Correct.
Technically, it is not as
Right.
opioid.
Right.
Sorry, you got
Right.
the two nurses.
No, I know what
Yeah,
I'm
yeah,
saying,
yeah.
but it's
So-
just as addictive,
It can be, yeah.
right?
It can be.
And
And
it
they
has,
know those addictions.
Sounds like you get addicted without the recreational benefits.
No, it does have
Well,
recreational
yeah,
benefits.
yeah.
Yeah.
Similar to those drugs that we also don't sell over the counter.
right, exactly. So anyways, they were giving different information to my colleagues and then they sent me down. So we had a nice conversation. But anyways, I brought it to you
Mhm.
after we brought it to the chief, because we do have that opportunity to ban it it's under local
Mhm,
control,
mhm,
under the Board of Health.
right.
So didn't know what you wanted to do with that. I'm just providing with information. The chief has more information and bringing it to your attention.
On a state level, what are they talking about doing?
There's 4 bills.
Okay.
Yeah, but
That they're just lost in.
well, they're not last note.
Yeah.
Everything has to be, when it's heard, it has 60 days now to leave that committee. 1, 2, 3, 4, actually there's 5. There's another one I found today. But, sometimes that takes a long time
Right.
and
Sometimes we can get a little more proactive on a local
Right.
level.
And there's other towns in the district, so I represent 6 towns. Each town is looking at it as well.
Oh, good to know.
Mhm.
Okay.
We can get it
Okay.
out of our area.
Right.
Well, I mean, they could still,
It
it's
has
just,
to go
I
further
think
for
there
it.
needs to be more information out there
Mhm,
on this.
mhm.
And everyone, when I first heard about it, mentioned it to, had never heard of it. Even the kids, there's a lot of
Yeah.
kids that have no idea what it is.
Well, that's good.
Yeah,
Which is good.
I know.
yeah, but
right?
it's gonna come quick once
Right.
they find out.
Right.
That's
It'll
the
come
problem.
quick.
Yeah.
And then in Pembroke, I went by a Pembroke convenience store today, and in bold, those neon lights, it says Kratom. Oh, it's funny because I was heard Kratom and then I was saying
Right.
Kratom, and the guys that had the thing said Kratom. So I don't know
Okay.
what it is.
I don't either, because
don't
I've
care.
seen kratom, and
Yeah.
I've heard people discuss kratom, but yeah, I don't know.
It's
Right.
tomato, I
Right,
guess.
Yeah.
right.
So this, I have to.
Yeah. So did any other towns in the Commonwealth pass any
Yep,
regulations?
it's in here.
So
So,
they actually did. Okay.
Yeah,
'Cause I
we
heard
have-
about a lot who were considering.
so we have
Okay.
Chelmsford, Dracut, Belchertown,
Okay.
and Lowell.
Uh-huh. And did they all pass similar legislation?
Yep, and I have that in
Okay,
here as well.
Okay, great.
Yeah.
Right. And is
So
that,
this is
right.
what they had written
okay,
through their Board of Health.
Uh-huh.
So regulations of Lowell Board of Health
Uh-huh.
prohibiting manufacturing, sale, and distribution of kratom. That's in here as well. And then the states that have banned it.
So,
Rhode Island and Vermont, I was surprised. Like, how did we miss it?
Mm.
Really? Like, this is what a shock.
I think because it's just rolling.
I guess
Yeah.
so, yeah.
it sounds like we can act as a local board much more expeditiously than the Commonwealth legislature and the whole
Correct.
process.
That's what, yeah.
Right,
And,
right, yeah.
they can catch up at their will.
Mhm,
In the meantime, we can have a
Mhm.
regulation in place to ban the sale
mhm.
of this product. That's essentially what you're requesting?
I'm just bringing it to your
I'm
board.
Me too.
Mhm,
I'm requesting it.
Uh-huh.
Why are we gonna wait
Right.
till something?
Right.
Something happens, somebody's kid winds up in rehab or dead,
Well, we've already had a good blind after.
Right,
rehab.
right,
We just
right.
did that.
Yeah.
so.
I'm not suggesting waiting, I'm suggesting being proactive. I like that idea. I don't,
It feels to me like it's gonna take an awful long time for this to move through the powers that be.
Right.
It just, if we do it, it's done.
yeah, we don't have that much red tape.
Yeah, we have 7,000 bills.
For us, what we would have to do, to enact a regulation
Mhm.
is hold a public hearing, advertise and hold a public hearing. We can't just unilaterally do that. That's an internal rule of the Board of Health. Hold a public hearing, get public input, and then based upon that input, enact or not a regulation.
Mhm.
And we get thousands of people who show up, say, no, don't do this. But, they give us pause, but I don't think that's going to happen.
I would hope that wouldn't happen.
Mhm.
I am getting
Mhm.
some hate mail about it now.
Are you
Yeah,
serious?
yeah. Yeah, I mean, to that point, there are people, my understanding, that say it does help them. So it would be interesting to hear from maybe some of the community agencies. Like, for instance, the Bridge Clinic up in Weymouth,
Well,
that
because
treats substance use disorder, and to sort of get some understanding of that.
I
Because,
wonder what Chief
Yeah.
Holmes has for
right,
information.
yeah, right,
Because,
Yeah.
because
Chief
we're.
Holmes.
right.
Sorry.
Thank you for coming, Chief.
Thanks for
Holmes.
having me. I think,
Like, I'm thinking it's got something good to add to those.
Uh,
no,
right.
I'll just talk. I didn't bring anything for you to
Okay,
consider in
okay.
terms of paperwork, but I can tell you that, we're fortunate to have a state rep that's taken a proactive approach to this.
Mhm.
I'd love to see it passed at the state level so that it
Mhm.
becomes, statutorily prohibited and we can do it under criminal enforcement for controlled substances. This stuff is scary. What you don't know is how you're going to react as an individual when you try this. And then you don't know what can happen after those effects take take a hold on you. It's right on the money that, you know, this interacts with your body and it behaves like an opiate and it behaves like a stimulant. So it's being equated to crystal methamphetamine. And that brings a whole host of problems. If you're both nurses, then you know about the heart rate going up, you know about respirations going up, you know about all those psychoactive side effects. And again, I think it's scary that something like this is just out there. It's being marketed. It's being put into a pill form. You can drink it as a tea, and you just don't know what's going to happen after you try it for the first time.
Well, it goes on the different doses, the different strengths.
Mhm.
So at a lower dose, it acts more as a stimulant.
Right.
And then becomes more of a hallucinogenic.
Like any narcotic does, you know, the larger the dose, the more somnolent you become, and that's not a good thing.
Yeah, but they don't
right? Yeah,
usually have the stimulant effect at the beginning.
But I also think,
Yeah,
regardless
yeah,
of what its therapeutic use is, we're not talking about therapeutic use. And by
It's not
banning,
regulated.
right, but and by banning it as a product to be sold in stores,
Mhm.
takes that out of it. If some therapeutic agency sees fit to use it, that becomes their issue in a whole different, segment. It's got nothing to
Right,
do with banning
right.
it for sale in the
Right.
town, and that's what we should stay focused on.
Uh-huh.
I don't
Yeah.
see that, I mean, people will say mushrooms, psychedelics, the pot's useful, great.
Mhm.
Maybe it is, maybe it isn't, I'm not a doctor, but I think it's staying focused on the fact that right now it's being sold arbitrarily, anybody can walk in and get it.
Right.
That's scary, so
It's uncontrolled right now.
absolutely, there
Correct.
is nothing.
And it's unregulated as well. So even the users are asking for it to be regulated so that they know exactly what's in the product. Some of it has been contaminated. People have gotten sick from that. My understanding is that it's not dramatically associated with an overdose. It's usually in like a multi-drug situation. Kratom or kratom, whatever it is,
Yeah.
is one of the drugs that are involved.
Mhm.
There's very little evidence that I've seen that's just.
So
Kratom.
interesting that you said that.
Okay,
And
yeah.
that was one of the bills named after the young gentleman that died.
Right, right,
But it was, the autopsy
right.
was specifically, because they said the same thing.
right,
Yeah.
right, right. But
It was
it,
specifically
yeah,
that.
it's extremely rare, but it does definitely
It is
happen.
rare,
Yeah,
you're right,
right.
you're correct.
I mean, the thing that jumped out at me is like, no one under 18 should have anything to do with this. It should be completely prohibited for
Mhm.
under 18. Adults choose to do things that harm their health sometimes, right?
Mhm.
That's right. So number one, it shouldn't be available to anyone under the age of 18. Number two, if it is, it should be totally regulated, licensed, and classified as like a Schedule I drug, just like opium, for people whose medical doctor does say this could be helpful for
Mhm.
you. And so that's just sort of thinking, you know, broadly.
That's the
here.
nurse in you.
Mhm.
Yeah. Yes, Dennis.
What I see as a course of action that we need to do is, one, draft a regulation for consideration, by the board. Once we've got the language of the regulation, down, schedule a public hearing. And then enact or not the regulation based upon public input.
So Dennis, I feel like we should be doing those both simultaneously. I can't speak tonight. And just get this moving, because we
Yeah.
don't need this. I'm gonna tell you, this sounds like a gateway drug.
Mhm.
This sounds like a
Right,
gateway drug. This
right.
sounds like
Yeah.
the thing that
Right.
kids are gonna get into, because they can go to Cumberland Farms and buy it, and they're gonna start, and we're gonna
Right.
see just a bad.
It's like the energy.
Quite, I'm
Yeah.
in total agreement. Just,
That's why I'm saying,
Right.
instead of delaying it out, I would like to see us move in a more rapid manner.
that's the most rapid manner we can. We have to have a regulation.
But
We
I'm
have to
saying
have a
we
public
can do it
hearing.
At the same time.
Yeah, we have to have a regulation.
But agreeing with you.
She's just suggesting that you draft the regulation this evening. That's what she's trying to
We
get.
can
across.
just copy what everybody has done and make it simple.
Yeah.
Like if it's
Don't
already,
recreate the wheel.
right,
Taking-
like, we just
Not
need to
taking
print
away
it
a
out.
step,
Yeah.
just accelerating the process.
Well, and in that case, we can just,
Schedule.
choose to adopt a regulation another town has already adopted that is, sounds like it's
Sure, we
to
need
our.
to tweak a little bit.
Yeah,
I feel like we can take a lot from
Right.
other towns.
right. I
And
mean,
like we
we're
did with
meeting
other
again.
regulations.
Oh, we're not meeting for another month, right? Because of Labor Day. I was thinking So if we met in
We
another
can
2
always-
weeks, we could sort of refine and just, get a few more questions answered.
We can always meet not on a scheduled meeting.
That's
Right.
We
that's
have
true.
that option,
Yeah.
All right, all right,
Yeah.
let's do it.
you know.
Kind
we're gonna
of
get
pull
this done.
everybody's
Yeah.
regulations and
Right.
talk amongst
We've
ourselves.
got
What
Lowell's
seems
right
best.
here.
I
Yeah,
thought
so-
Lowell was good, but I thought their fines were not. It's like it gives them their penalties, basically. Need to be a little tighter, especially for that city.
Mm.
You know, I thought they were a little loose for being a city, coming from Lowell, I know.
The ones that have been
Yeah.
enacted it are listed at the bottom, so it'd be
Yeah,
easy enough
which-
for everybody to go, one person
Right.
go poke from
Okay.
each town and you
Yeah.
can all decide what you wanna write.
Oh, I see these, okay, okay.
Yeah, right at the
Okay.
bottom of that last
Yeah,
page.
so there's 4, Lowell, including these 3,
Mhm.
is that correct? Okay, all right, yep, that'd be helpful to see like their language. Now, last time I looked at the bills that were pending,
Mhm.
it was very skeleton, it was just, I mean, there was no,
Information.
right,
Yeah.
right. And so has that changed, or are they still?
Let me see this one in here. They are. I think I did. I don't know.
Mhm.
I can find out for you. But once it's heard, it has
I could look
60
at them
days
too.
to
I could,
move.
yeah, I could go back and look at them and mark them so that, if something
Yeah.
changes, you do get
Yeah.
that alert. I can do that. I'm just mindful of, the experience with, medical, recommendations and information, particularly during COVID,
Mhm,
when we were all accused of being overly regulatory,
mhm.
and want to be careful. I mean, I think we're at a point right now in healthcare that we're really trying to reestablish trust
Mhm.
with the public. So just to be sure that we have our facts in order before we proceed, and it means a couple more weeks. But like I said, I lean heavily towards as much regulation as we can reasonably do. And hope it would be statewide. Otherwise, all anyone has to do is hop on their bicycle and go to the next town.
Right, right.
But yeah.
The other way to
Yeah,
look at that is,
Mhm,
we
mhm.
can be spearheading
Right,
this and
right,
start the trend
right.
for the area.
Right.
And, we know that there are drug problems and we know that we have ways to help
Right.
prevent them by taking away gateway drug access.
Right.
We can
So it gets
help
done.
people be healthier
Right.
and
Right. And getting that education out there in the community.
Yeah.
So Chief, can you speak to, and we don't need the names, I don't think, but how many establishments in the town of Kingston are you aware of where it's for sale?
Well, we have
Have any-
18 tobacco licenses, so,
Okay.
and
Uh-huh.
the
Yeah.
possibility is
Right.
there is at least
Uh-huh.
18 places selling it. Now, whether all 18 are doing it, I can't tell you that,
Right,
but
okay. Do you have any idea?
There's probably 2 on our radar that may be doing
Okay.
that.
Okay, yeah.
And that's not that bad, but I think the.
Oh,
the
it's,
theme-
it's too many, right?
Right, the
right,
theme here is
right.
being proactive about it. So.
Right, okay.
because
the only ones
anybody-
I'm aware of is Humvees and MK Smoke. Is that the 2 you have? Oh, okay.
I don't want to comment. on
Yeah, no,
that.
that's
Okay,
fine.
yeah, right,
Um,
right.
No, I just think that, like, getting ahead of it is a good thing.
Right.
If there is a clinical benefit to it, then,
Right.
then this stuff should be prescribed by a medical.
Exactly. If there is a benefit, then it should fit under like a Schedule A drug, which would, limit
But-
access.
Yeah.
But
And wouldn't-
our issue, like, our banning it here does not negate somebody's medical use. It just negates
It
it
just-
being sold in
Does
this
it?
town.
Okay.
So what it's doing is negating it being sold over the counter
Oh, right, okay,
without
right,
Yeah.
prescription.
right.
You know,
okay,
we're making it
Right,
so they cannot be sold like bubble gum.
right.
Which at this
Right.
point it is.
Okay,
Yeah.
okay,
Which
right.
funny
right.
story, I
Yeah,
had a friend,
yeah,
it was
yeah.
3 o'clock, friend my age, 3 o'clock in Cumbies.
Mhm.
And usually at 3 o'clock you need the coffee or something, and it was called Pep or something like that. And she had to call her husband, she said, I was high as a kite, and it had credit in it.
It was the
That's scary.
Pep or something like
Uh-huh.
that, yeah.
Uh,
Second energy.
There's very
Yeah.
catchy names for this
Yeah, I
stuff.
know, and they have lots of false claims,
Mm.
they could cure everything, whatever it is.
Yeah,
know,
realistically,
yeah.
Yeah.
what we're looking at
Mhm.
is the earliest, a ban could go in effect in Kingston is probably about a month.
Mhm, mhm.
And acting expeditiously,
Mhm.
starting tonight, we make a decision to, get a bunch of, sample, regulations from other towns.
Right, right.
No, no
Oh, yeah.
point in reinventing the wheel.
The Board of Health will speak, yeah.
And then once we have that, we go over the language to our satisfaction and then publish it and schedule a public hearing and then enact it or not. You can't say for certain, I'm pretty certain what the likely vote will be, but it sounds a little presumptuous. So we're gonna have a public hearing to get public input and then we'll render the verdict we've already decided.
Right,
No,
we
we're
wanna
gonna
be
decide
very
based
careful.
upon what we hear.
We want to be very careful about that, yeah.
Has there been any discussion at the meeting?
Yeah, we've spoken briefly about it at the last grant meeting, because we were there actually not for the
It has come up.
for to do interviews. And so at our next grant meeting, it will be addressed more fully, because I'm,
We're
there's
out
definitely
of-
other towns that are willing to get on the channel.
Yeah.
We're a part of a grant
Right.
with 5 other towns.
Right.
Plymouth and Halifax, there's a bunch of,
Mhm.
and that's why I asked that question, if you're all.
I know Duxbury's interested in doing it.
And
We're
Plymouth,
part of
Plymouth is.
Plimpton,
Yeah.
Carver, Wareham, Plymouth,
Mhm.
us and Duxbury are the 6. So I know that Duxbury's very adamant to do this, as is, I believe, Plymouth is right on board.
Mhm.
I can't speak to Plimpton and Carver, but
I
I
have
think
not,
it's already done.
yeah, I have not, not brought it up to the chief in Plimpton yet. Thank you for reminding me. But I have talked to, Plymouth,
Karen,
yeah, and Pembroke. I spoke to Pembroke.
Mhm.
And Halifax.
Well, that will
Just
keep
makes
our
it a
bike
little bit
riders
harder.
from going one town over.
Yeah.
I know it, I know.
Yeah.
The little
He's gotta
12-year-old
Oh,
on
and
their bike.
yeah,
Yeah.
that was right on. board.
Yeah.
But have there been other instances in Kingston? Like, have you heard,
Yes.
sort of chatter about it?
It's
Is it
around.
with young people or?
There was a middle-aged individual that
Okay.
overdosed 6 months ago.
Okay, uh-huh,
So we had a record of it because we responded along with the fire.
right.
And he later came in to apply for a firearms license and we denied him.
Yeah.
So it went all the way to a hearing because
Right.
he exercised his rights of appeal.
Okay, yep.
And the judge upheld the decision to say, no, you're not gonna get a
Mhm,
license.
mhm.
So, I mean, there hasn't been a ton, but when you go to an overdose, there's always
Yeah.
what is the real substance? What's the
Right,
overdose
what's
from?
really in it, exactly, right,
Hmm.
right, okay, yeah.
Mayor, to move things along, I'll make a motion to prepare a set of regulations, control, relative to, I don't even know, how do you pronounce it?
Kratom or crap.
One or the other, I don't know.
Kratom.
KTO, okay, collect our regulations, draft regulations relative to the control prohibition of the sale of Kraton products in Kingston for the next meeting. For our next scheduled meeting.
Do we want to do an extra meeting? Because we're not going to meet again for another month, right? September 15th.
We have 2 meetings a month scheduled, usually
One is
one.
Canceled.
Right, but the next one would fall on Labor Day, so obviously we won't be here. So the next available date would be the 8th
Well,
or the 15th.
can we see what rooms are available?
Uh-huh.
Because I know sometimes that becomes an issue.
No, I think Dennis was asking about just having a board meeting. I'm gonna ask, that's the next question, is when do you want me to schedule the public hearing?
Okay, that's what I was saying was the board meeting. Sometimes we've had trouble in the past having
With
rooms
20
available.
Right,
So we really can't schedule the public hearing until we have the regulation, because we have to publish the regulation that we are proposing.
okay, so do we want to meet on the 8th? Just for the sake of getting this regulation,
Mhm.
there's 4 towns, so 4 people.
Mhm.
Each grab one, you guys should all be able to come up with a concise version.
Mhm, yes, okay.
Does the 8th work for everybody?
If we do the same 5 o'clock time, I
Yep.
think it would, okay.
Motion made, is there a second?
I'll second.
Look for
You pick, Laura.
That's it.
Dennis,
All in favor?
Aye.
Aye.
how many
Thank
days
you.
does it have to be published in order for the public hearing? Like, how many days in between do we need?
between posting and having our public hearing, how many?
What-
It's a
These
process.
days,
Laurie,
we need
Laurie, help me out. for a minute.
2 weeks,
Excuse me, Laurie.
Yeah.
22nd.
Yeah, you have to publish it in 2 editions of.
Which is so challenging
There
to
you go.
do these days.
Yeah, I gotta find a newspaper to publish
Something
it.
Halifax, Kingston Express.
Yeah.
Yeah,
right, right.
right.
So
And they're
if we
pretty.
met on the 8th,
They're really,
and we
yeah, I think
published
they're good.
to have a hearing on either the 22nd or the 29th of September.
That's.
Hmm?
We'll work with that.
Because we could wrap it up on the
I
next
was
meeting.
gonna look and see which of those Mondays there's an opening in 203, 200, and I'll book it in for that.
Okay.
So either the 22nd.
This was easy, Jesus.
Thank you, Kathy. You guys made it easy.
My goodness.
No, the more I
What do I
read,
have?
the more I read about it, the more I was.
That's what I was stunned, like we didn't know, we didn't realize that this was in the town, really.
I didn't even know there was those bills. I
Yeah,
know.
yeah.
Well, it's everywhere, but.
Right.
Thank
Rhode-
you
Rhode
for
Island
being
and Vermont
so-
beat us to it.
we did.
Massachusetts better
I know.
step it up, huh?
Because, well, I'm not surprised,
Oh.
because Vermont has a huge.
20th or the
Yeah,
29th,
right,
but I can,
right,
as soon as I know what, I'll email you and say that.
Yeah, I'll be there.
Once we lock it
Right,
down.
okay.
Thank you.
Thank you, thank you very much.
Thank you, everyone.
Thank
Yeah.
you.
Great
Thank you for coming, chief.
Thanks.
Great night.
Yeah, nice to see you.
Nice to see you.
Hey, Heidi, could you check in with the ER staff at, BI in Plymouth, and I can check in with South Shore just to see.
Not really connected there.
You're not anymore, okay, okay.
You now.
Oh, all right, okay.
Um,
I can check in at South Shore with the ER folks.
Okay, yeah,
And I
I
can-
don't have many connections there anymore.
Okay, okay, and I can also check in with the Bridge Clinic, up in the Gragan Clinic up in Weymouth, which is,
Yeah,
yeah.
you know who I will reach out to?
Mhm.
I can reach out to Sarah Cloud. She is the Director of Social Work
Mhm.
at Implement,
Oh, perfect,
Uh,
yeah, right,
at Israel
right.
Plymouth.
Mhm, mhm,
And I should be able to get a feel for her,
mhm, right, great,
what they're
okay.
seeing.
Mhm.
And she also has boots on the ground when it comes to, she's part of the overdose team.
Oh, perfect,
So-
yeah, that's good, okay, okay. All right, okay.
So do we need to divvy up the towns?
I'm gonna
Take
email
them-
Sarah Cloud, somebody else can do a town.
I can do Lowell.
Let's see, where are these 4 towns again?
It's Belchertown.
Mhm.
Lowell. Drake, Chelmsford, Drake, Belchertown, and Lowell.
I mean, I'm happy to do 2 of them, I mean, that's,
We just basically
Yeah,
need
yeah.
to get the
right.
wording, so
language,
you guys can
exactly,
sit down and say,
right.
yes, we like that, no, we
Right.
don't.
Right.
Come up with
Right.
something for the eighth.
Chelmsford was pretty basic.
Okay.
Joyce, I'd ask,
Yeah,
Yeah.
I would ask.
So
if the-
Cheryl's already done some of this work, guys.
No, it was just off the information that Joyce sent me.
I don't care.
Right.
Yeah,
great.
it was Chelmsford. It was
Yeah.
very short
Ladies,
and very.
All right,
Joyce, if there's another grant meeting between now and then, would you ask if any of them or their boards?
Absolutely.
Okay. And if they do, bring along copies, please.
Mhm, mhm.
And Joyce, it's your health agents report that's next on the agenda.
All right.
Hey, did we square away the towns? Cause
I think
I-
you're doing 2 and Cheryl's gonna do 2 with Sunderland. And
okay,
you already did Chelmsford, right?
Chelmsford was what you sent me and it's pretty generic.
Is that their wording or is that just, I don't know, I don't
It's
want
the
to,
regulation.
okay.
what's the regulation? Okay, all right, so Chelmsford we have. Okay,
And then Lowell was a little bit better.
Mhm.
But
Okay.
considering they have a lot more.
all right, so I'll do Drake and Belchertown.
Okay.
You're up, Joyce.
All right, as far as, stuff that's been going on in the department, septic has been pretty steady, nothing monumental. I'm sure everybody's aware that 273 Pembroke Street, the house that I had to condemn has been sold and is moving on. I've made contact with 28 River Street. And spoken with one of the owners of that and my understanding, they're cleaning it up. He was over there cleaning it when I went to visit, trimming back bushes and stuff and securing the residents. They are supposedly in the process of selling the property, so hopefully that will soon be not a blight. It's come to my attention that we also have one at 3 Marsh, so that correction order will be going out. We've gotten a number of just sort of really obscure complaints. We had a noise complaint to do with Napoli's vent, who were on vacation for a month. So I just approached the owner of the building. They apparently went up and greased. So now people are okay. We have trash issues over at Cranberry Court. So I've had enough dealings with the management company, so I have a direct line of communication. I just emailed her the picture and said, you need to clean it up or I'm gonna have to send a correction order. This is, needs to get done. So hopefully that'll be cleaned up by tomorrow. I just got it today. And then we still have the outstanding issue of Country Club Way with the correction was sent. The trash has not been, picked up. We did send him a letter. Lori, what was the date we told him?
We told them the 15th.
The 15th is our next scheduled hearing. So he's asked to appear on the 15th to show up to have a hearing in front of you guys.
September 15th.
Yep, to explain why he didn't pick up. No, well, didn't show up and won't pick up the trash. So we'll proceed with that when it comes. We're signed up for the MHOA conference that's in November, so I was able to get Lori in to be able to go to that as well. The tracks are good so that, she's being exposed to all different aspects of the health department, which will make hopefully her job a little bit easier as well. Other than that, just the same, we have an issue at 22 Main Street that is illegal apartments. I use that word carefully because it's sheds. That people are living in that have illegal plumbing, illegal electrical. It's unclear where septage is going into the ground. So buildings involved, sewers involved, we're involved. It will be, we have a meeting with town council on Thursday to discuss how to move forward with this. Everybody's pretty much out of the facilities, so that's good. We didn't have to, one person chose to leave on their own. Person that remains is actually in a legal apartment, so that person can stay, but he is leaving at the end of the month anyway, so basically that part of the property will be vacant. So I will give you an update as it proceeds forward.
So did all those people leave voluntarily or did they need to be placed somewhere?
So one guy, yes, left voluntarily, but there's also a criminal issue of a restraining order that's against him, so it was in his best interest to vacate the property.
Mhm.
The person that remains, like I said, is in the legal
Mhm.
apartment.
Okay, right.
There was a third person, but apparently that person doesn't live there all the time. They have a significant other which they stay with at times, so that person is staying with their significant other. There is evidence that other people have been there, but they weren't there at the time of the inspection. Like this clothing and, people's life, goods are in these apartments.
Mhm.
So that's what we've been dealing with for the last week and a half.
Mhm.
Hopefully, they'll, town council will give us guidance on how, because everything has to, sewer wants the driveway dug up, because you can't tell where the sewer pipes are going. There's allegations that there's literally 50-gallon drums just sunk that's holding sewage, and this is quite close to, waterfront, so there's even a question if sewage is being released into storm drains that would flow out. So,
Well,
On
that's not
that-
like sewer's problem.
yeah, right, but it's also a public health problem if it's going into the water, because
And
it's gonna be
affecting
my
the
problem.
beach. right?
Yeah,
Right.
and so far this
Mhm.
year,
Mhm.
we only have 2 more weeks to go.
Mhm,
There has
mhm.
been, the numbers have been fantastic at all the beaches, so that's wonderful. So far, so good. We also remained at low risk again this week for both Triple E and West Nile.
Nice.
Kingston is holding steady at low, which is good. There has been an uptick, I believe it's in Plimpton. One of the towns sort of heading towards Plimpton, Halifax, Pembroke area is at medium. So hopefully this little cold snap will do us some good.
When you say low risk, does that mean no samples have been found?
No, it means
Or
that
negative?
it's, the incident rates of samples is such that it's insignificant. And there's been no whole human cases.
Okay.
It's just sampling, so
Mhm, mhm.
that's my understanding of how the risk is determined.
Okay.
And I know that I sit on Plymouth County mosquito, so I get the updates when I go. I get to talk to the entomologist, so they're
Good,
trapping like crazy.
good,
So,
good.
so far, so good.
I saw a sign up in Halifax saying Triple E has been found in Halifax.
Yeah, so there's,
Does that mean a
then
human
that's
case?
that's the medium,
No,
not
okay,
necessarily a
okay.
human case. It means that
Okay.
the incident rate is
Mhm.
significant enough for them to raise the risk.
I noticed that one of the surrounding towns, I forget which one, had posted the link for if people wanted to contact Plymouth County
Mosquito.
mosquito
Yeah,
control.
well, ours is on. It should be on.
Mm, mhm.
Is
We've
it?
had it, we had it
Every
posted.
time I
Yeah.
post the
Yeah, we
stream
post,
frames, I post their phone number. So they have a
and there's a
website.
link.
There's a website that you can
Yeah.
click the link and it's so easy to use. Because sometimes calling mosquito control can be quite tedious.
Yeah, because there's nobody,
Mm.
it's
Mm.
one person.
already have, but I'll.
It should be, the link should be on there, because I know I sent it.
But maybe if they just posted the link, like being like, hey, if you'd like to get sprayed,
Mhm.
this is the link for mosquito county, for
Yeah.
mosquito.
And
control.
it could have been on there, because they just updated our website, like the whole town's website. So we're having to go through and make sure that everything transferred.
Yeah.
And there may be some things that need to either come off or be added in.
Yeah.
So,
I just thought it was really easy and I actually followed the steps, right?
yeah, it's so much better when you go on.
It was so much easier than trying to call. So,
Yeah, they've hit like
Mm.
50% now of everything is going, and it's only been up, I think, a month.
are they spraying the schools yet? Cause we have sports going on.
If we want them sprayed, I will have them sprayed.
Yes, please.
idea.
Oh,
Because the high
Right.
school's out there. The boys-
They already started.
All the fields.
Football has already been out there. Yeah, let's spray all the schools, all the fields.
All-
Yeah, great.
All right,
Right.
I'll call them tomorrow.
Thank you.
Yeah, no worries.
Yeah, good.
Anywhere
good
else?
Pick up on that, yeah.
How about Poddle?
Yeah, all
Poddle.
the fields.
All the fields.
All the fields.
All the
Green,
playing
right?
fields.
I didn't know, is Poddle considered to be the school though, or no?
That's not, that's why I say schools
All right.
and all sports
Oh,
fields.
The field.
All right, and I'll get in touch
No,
with
is it a
rec
field?
too.
Mhm.
All the fields.
Mm,
All
Thank
right.
you, okay.
Yeah,
We'll get that done.
thank you.
So anything about tick surveillance, any prevalence or anything?
Tick surveillance is still, we have the epi,
Uh-huh.
but I have not received anything that says we're getting a ton of babesiosis or
Okay,
Lyme's
okay.
or anything.
I've
so-
seen plenty of
Yeah.
It's out.
babesiosis
Right.
and plasmosis
Right.
and not as much Lyme, but in the
Other
first
two.
sick people,
Mhm,
Yeah.
mhm, mm,
you know, just
right.
within my case reviews.
And
So,
right now, the tick cycle is we're down. It's gonna ramp back up in the next week or two. So they go through a
Uh-huh.
cycle. It's sort of like August is like a low
Dormancy.
tick month.
Yeah.
And then September into October is when you really
Well,
need
they
to
perk
be,
right up.
yeah.
Mhm.
Well, you just need to be careful.
Yeah, yeah.
So, and I know we've posted stuff on there about be careful. We have our tickets.
We have our
Do we still have tickets?
Yeah.
New
We-
masking
we-
tape inside out. on your ankles.
Yeah,
No,
and
what?
we did,
Uh,
Lori was nice enough to go to the night out and hand out tickets to people, so we made our presentation.
Nice. I would have did that with you, Lori.
Yeah.
Anytime you need. to come.
We were on the boat.
Yeah.
But yeah,
And I would have gone, but I was at a doctor's appointment.
Okay, anybody have any other questions on the health agent's report? And if not, Mr. Randall has a public service announcement that he's
Yeah.
presented tonight. Want to read it over, Dennis?
Yeah, it's, Kingston Board of Health Public Service announcement. Feel free to edit, change, or revoke anything you want. Kingston homeowners of Title V septic systems should be aware garbage disposals are strongly discouraged. Food waste adds excess solids to septic tanks, which can clog leaching fields, increase pumping costs, and shorten the life of your system. Title V regulations require systems to be properly maintained to protect public health, water quality, and the environment. The installation of a garbage disposal may require a system upgrade or increased frequency of inspections.
It's actually should, can we correct it? Because it
Yeah.
should say will.
Will,
require,
definitely,
and
right,
It
right.
requires 50%.
Right.
And then the frequency of inspections is not, that's not a thing.
Right.
I mean, it's a
Okay.
good idea, but it's not a thing.
Okay,
But other than that, I
Excuse
think
me,
it was
why don't
great.
we let Dennis read the whole thing?
then
Then,
you can chew it apart.
then you can.
Sorry, it was just.
Oh, that's quite all right. The installation of garbage disposal will require a system upgrade. Protect your investment, your wallet, and the environment. Use composting and municipal waste options instead. A healthy septic system means a healthier Kingston. Think before you grind. Your septic depends upon it. If you have any questions or need more information, please contact the Kingston Board of Health.
I think it's great.
I do too. I think you did a great.
Scott, I'd like to
Okay.
Go ahead.
after we say that the garbage disposals are strongly discouraged, I would say and not advised.
That was a good one.
Yeah, I mean, again, this is change anything you want to on it.
No,
That's what I'm saying. I
Yeah.
was hoping.
I like it. I think you did a great job, Dennis.
yeah,
Perfect.
And I would just add substantially, that shortens the life of your system substantially.
yeah.
Right,
So we
Right.
start at the beginning, so I gotta
yeah.
Okay.
edit this so I can put it up.
Kingston homeowners with Title V septic systems should be aware that garbage disposals are strongly discouraged and not advised. Food waste adds excess solids to septic tanks, which can clog leaching fields and increase pumping costs, increase pumping costs and shorten the life of your system substantially.
And substantially shorten the life of your system.
Okay.
And
Just
There you
throw
go,
substantially
Dennis.
in there somewhere, Dennis. Should we give a nod to the, to Gene Nolman's, that food, you can do food disposal at the dump.
I wouldn't do that. I
No?
would
Yeah.
just stick with what we got.
Okay, I
Yeah.
wasn't sure where there's an option to dump the food waste.
well, it says municipal, so it
Okay.
indicates it there.
That's what
Mhm.
they have.
Right.
Well, no, they have a whole compost, they have a whole
The
system.
composting bins, yeah.
Yeah, they have a thing.
They do.
So it doesn't go to the dump, it goes into a food recycling, like,
Composting place, they
Yeah.
process it.
Yeah.
Title
Yeah, that's
V
great.
regulation. Go ahead, Heidi.
oh, you want me to keep
Great
going?
job.
Yeah,
Yeah.
you want to go?
Oh, I will read the whole thing. Title V
ahead, Heidi.
regulations require systems to be properly maintained to protect public health, water quality, and the environment. The installation of a garbage disposal will require a system upgrade. Protect your investment, your wallet, and the environment. Use composting or municipal waste options instead. A healthy septic system means a healthier Kingston. Think before you grind. Your septic depends on it. If you have any questions or need more information, please contact the Kingston Board of Health.
No, it's great.
Well done, a dramatic reading.
I know.
I don't know, but I really appreciate it, Dennis.
I think you did a great job. Thank you very
Yeah.
much, Dennis.
It's
Yeah,
super.
well done.
That came out really good.
Okay,
Great job.
We found your niche.
and the last subject on the agenda for this evening is how to address the unpaid fines. Joyce,
Yeah, so we have outstanding fines that need to be paid. So in your regulations, you you have it, so I want to know how you all want me to proceed with this.
Fines for,
Non-compliance,
With tobacco.
with tobacco, with food regulations, inspections, you know, like when we go there multiple times and you
Mhm.
haven't cleaned.
Um, do we have multiple vendors or is it a
It's
single?
down to two
Okay,
different vendors. Everybody else is paid up.
and these two vendors, are we looking at,
Well, I'm hoping will be rectified. The second one is a larger issue.
is that the one that we are in legal issues with also?
Well, at this point, given the repeated tobacco violations and that's actually of more concern than the food violations, but it's everything in totality. I am working with council because some of the mechanisms have changed, why I have no idea, but I would, based on what you guys wrote for regulations, I would move to have a hearing, to have the vendor come in, the owner come in and have a hearing. I would like to revoke the tobacco permits at this point.
Absolutely.
we've given,
Yeah, just to clarify,
Lots of-
this was discussed at a previous meeting, correct? Is it the
Well,
same
this has
case?
been ongoing.
Okay,
for
but I
a
mean,
year,
from
my 2
right,
years
right,
here.
right, but I mean, from my experience, it's just, okay.
Yes,
Okay.
it's
So it's the
repeated
same,
violation.
it's the same case and it still has not been resolved, correct?
Correct.
Okay,
Yeah,
okay, right, yeah.
And
Who's
isn't
this?
that part of the regulation anyhow, that if you don't pay your fine, you're
told you.
maybe subject to revocation?
Right.
I don't remember.
I'm sorry, Dennis.
No, isn't that part of the regulation anyhow, that if you do not pay your fine,
Right.
your permit will be revoked?
But even more importantly, in your regulations, it clearly states that after the third or fourth offense,
Mhm.
if there's a continued egregious disregard, that a permit can be revoked. At this point,
Mhm.
it feels like, considering you guys, not the board, I don't know who was on the board when it happened, but
Well,
the board has already given
I gave
this-
them a break.
owner repeated breaks, and they continue to do it.
I have a big heart. I know.
So,
We're trying to have the brain the same size as the heart, that way you'll all get to balance.
thank you, Dennis.
So according to our regulations, the next step is to invite,
Yes, they
Right,
need to
yes.
have a hearing.
yes,
So
have a hearing. yes.
everybody's on board with that. So I guess we need to revisit the whole, because the next schedule, we have a board meeting scheduled for the 15th,
Mhm.
because that's our normal date.
Mhm.
Mr. Tongsberg has been issued a request to appear at the hearing because he didn't show for the last one. So that is already scheduled for the 15th. Or let me rephrase that. Is the board able to communicate on just the basis of those, putting together a ban for the Cratonum without having a meeting, or can that be done on the 15th and we still, which means we'd have to push the public hearing now even farther, because you guys say we need 2
No.
weeks.
Have a meeting on the 8th.
Yeah,
Just
just to
Just
do
on
with that.
Just the kratom, right,
Okay,
exactly.
All right.
Yes.
and then the
And this
15th, we
other
go back
business
to our regular.
with
right?
what's his name, if it's not resolved, we'll schedule the meeting for the 15th. But if in fact it's been resolved,
Oh.
then we'll move forward. Okay?
Okay, I'm gonna send him a letter tomorrow. saying
You
he
go
needs to
send them what you're.
appear on the 15th. It is not gonna be resolved as it's going on month
Uh-huh.
4 or 3.
Hmm.
Okay, you send them a letter.
I will.
Please send me a copy.
Okay.
If there be no other business, I make a motion.
Oh,
Okay,
Sure.
just one other.
What were you about to say?
Well, I talked with you about this on the phone. So I looked into our membership in the Massachusetts Association of Boards of Health, and currently we're not a member. We haven't paid dues since 2023. So I'd like to make a motion that this board renews their membership and pays the invoice. I think it's $150. Is there a second?
Would
No.
that cover all of us?
Yes, yes,
If they give membership.
For the
of
board.
yes,
Correct.
yes,
That's
yes.
right, Cheryl.
Rosemary, what was
Yeah.
the motion? Sorry.
The motion was for this board to renew our membership with MAHV, which had lapsed apparently in 2023. And then pay the invoice for that, which is $150 a year, which covers every member of the Board of Health, right?
Moved, seconded.
I'll second it.
Any discussion? Heidi? You have concerns?
I don't think I have concerns.
Okay, you have what? You have that look. What's up?
My grandmother's in the ER.
Sorry.
Okay.
Yeah.
You good with it?
Yeah.
All in favor? Aye.
So where does
Okay.
it come out of?
Say what?
Where is the money come out of? It can be funny, like, I don't know if it's
No, good
expected that
question.
it
Yeah.
comes out of,
Do we have the funds? To pay
you
that?
have seen the budget, right?
We haven't seen the budget in a while.
I've never seen a budget since I've
No,
been here,
it's the same
so,
budget,
okay.
the same as last year's. We didn't get diddly squat.
Yeah, but we had been paying the membership.
Just
fee.
send it
Oh,
up
no,
to the
it just-
treasurer's office.
Care about is where it gets paid out of. If I'm
I would
supposed to
say
pay it,
this
so I
is
know,
budget, if
make
we-
sure it gets done, that's all.
Unless suppose it's a hardship that we should know about.
Fees.
Yeah, no, I'm just.
Okay.
All I wanna know is if we're supposed to pay it or you guys pay it. That's all I
No,
care
no,
about.
it's
It's
the
the
board.
board.
It's the
Okay,
town.
that's all I needed
The
to know.
board expense.
Okay.
It belongs to the board, so if the
So it comes
members,
out of the budget. It's,
yeah,
I got
the
it.
members come in and
And
out,
the
the
fees.
other, the new members will be covered if
Correct.
our old members are no
Dennis, what
longer.
did you say a
Correct.
minute ago?
If there be no other business, I make motion to adjourn.
Look at that one.
All in favor?
Aye.